I'm Evan. My wife Stacy is due in a couple weeks from now. Our goal is to have a natural childbirth. In advance of the delivery date, is there anything we can do to help reduce the chances of needing a cesarean section?
You know, sometimes there's nothing you can do to prevent having a cesarean section. If the baby's having problems, having distress, if you have a history of herpes, if you're having premature labor or bleeding, sometimes you just have to have a C-section. There's no way around it. And thank God we can do that and we can deliver babies safely that way. But there are a few things that you can do to lower your risk of C-section, because these days, actually, a lot of women go through those. In hospitals, it can be 25 to 35% of all deliveries are by cesarean section. So a couple of things to think about. One is to consider having a doula. A doula is a labor support that you have during your period in the hospital as you're going through labor. And they can be so reassuring and helpful that literally can reduce your risk of having a C-section by 25%. You also want to consider having a home birth. A home birth isn't for everybody, and you want to discuss that with your obstetrician or your midwife, but it's clear that you can reduce about 80% of cesarean sections through home birth. There are other risks associated with home birth, so you have to have a discussion about that, but you can dramatically reduce cesarean sections that way. And then one other thing is by doing a childbirth education. Prepare yourself ahead of time. Hypnobirthing is a wonderful way of learning how to relax yourself, because if you can relax yourself during labor, that helps to open up the muscles and allow the process to occur rather than getting stopped.